Whoop, it is. We are live. Hey, welcome back to another Healthy Happy Hour presented to you by Neighborhood Medical Center. Ryan White team. I am Joseph Ward, and as always, I'm here with the magnificent Mr. Mathias Sweet. What's going on, Mathias?
How y'all doing out there today?
Yeah.
We're doing pretty well here. You know, we making it work, living life to the fullest, working.
Right.
Joe, I'm just getting off work. You too?
Man, look here. Do we ever get off?
No.
Right.
We have to serve the community. That's what we're here for. So it seems like we're working 24 hours a day.
Blood in, blood out. That's how we do it. So we appreciate everybody who joined us for this live event, and even those who are not able to catch it live but able to catch the replay. We appreciate you all joining us. You know, every third Thursday of every month, we give you a healthy happy hour. Usually it will be face-to-face. We will have snacks and all type of interactive information that we give. But because of the COVID-19 pandemic that's going on right now, it has spoiled the way we do healthy happy hour. But we decided that we want to continue doing our healthy happy hours because we cannot deny our people information. So here we are again. This is our fourth installment of our virtual healthy happy hour. So we happy to be back. So today we have back with us Dr. LaToya Butler, who is the dental director for Neighborhood Medical Center. She's back with us to give us a lot of great information on the basis of oral health care. We want to have a series of healthy happy hours with Dr. Butler so we can make sure that our community is keeping our oral health on par and up to date and all those good things, because we want to be old with good teeth. So I'm gonna shut my mouth unless there's anything else Mathias would like to add.
We just feel like this subject is a real important subject because a lot of people don't know in the community that your oral health affects your whole mind, body, and soul. That hence goes to our podcast that we do that's focused on our mind, body, and soul by Neighborhood Medical Center, our NMC podcast. So you see that every Wednesday. Right. We have a new one coming up. You can go to our website and check out the links on there. Neighborhood Medical Center, MC Podcast. That's it, right? NMC Podcast. So, but we really want people to understand that your oral health does affect a lot that goes on with your body. So if you have poor oral hygiene, it's going to affect you in some way medically as well. So this is why we're really focusing on our oral hygiene pieces to make sure that we can bring Dr. Butler back and other dental people to explain the importance of it, because a lot of people don't know how to take care of their teeth. Right. You see a lot of the young little kids and they walk around with the little grills, with the little silver caps. So we trying to prevent that from being in the community and everything like that. So we have a better healthcare system itself, and we can utilize our system, especially with our dentists that are out here.
Right. So without further ado, once again, Dr. LaToya Butler.
Woo!
Right.
Good evening, everyone. So in talking about the basics of oral health, I'm actually going to cover three very important topics. They seem short, but there's a lot of information to go into each of them. The first one is why you should brush and floss twice a day. The second is what causes bad breath. And the third is how all of this affects your overall health. Now, as I dive into the three of them, it seems pretty basic on the surface, but there's a lot of detail within each of those topics that'll help you understand why all of this matters for self-esteem with your mind, how all of this matters with your body, how it affects the rest of your organ systems, and then as long as your mind is healthy, you have a pretty healthy soul. So we'll get started on brushing twice daily and flossing. Are there any questions about that before I even start?
No, not right now. Not right now.
Brushing and flossing?
Yes.
So am I really supposed to brush like more than once a day?
Yes, sir, you are.
Okay, because I know a lot of people don't do that. What about flossing? They say you're only supposed to floss after you eat.
So let's talk about when you should floss and brush. So most of the time we have people who brush a lot, and then we have people who don't brush at all. So for those who brush a lot, you should never actually brush as soon as you finish eating your food, because what's happening is your teeth are going through what we call a breakdown or demineralization. And if you brush at that moment, you can actually brush off healthy enamel. But if you wait about 30 minutes after you've eaten, maybe rinse or drink some water, it'll take the acid down on your teeth and you won't have cavities or brush away the enamel. For those who don't brush as regularly, that bacteria that's sitting on the teeth, because naturally your mouth has bacteria in it, it's waiting on food to touch the teeth so that it can form a cavity. So it's very important that we brush no less than 2 times a day. If you can't get it in midday, always make sure you brush first thing in the morning, because no one wants to feel a sweater coat on their teeth. And then always brush at night, because it may sound disgusting, but it's very real. What you don't brush from your mouth at night is like sitting up in your digestive system. So that's why it smells funny in the morning, but also it gives the bacteria time to attack your teeth, and then you eventually form cavities.
Okay. I got a question.
Yes, sir.
Is there a certain type of toothbrush? Like, you know, you go in the store and you sit there, like I do. I sit there for like 20, 30 minutes trying to figure out what toothbrush I want, what brand and stuff. But it's a soft, medium, hard. Is there a certain toothbrush I'm supposed to get?
So always focus on having soft to medium bristles. You don't ever want to have a hard bristle toothbrush. They sell them, but they're not healthy, especially when you're not using the correct technique. So soft and medium bristles, you're kind of doing all of the work with your hands just by moving the brush. So you don't need to force or put too much pressure where the bristles on the brush look flat. You're actually putting too much pressure on your tooth. You just kind of want to move it around the teeth just to get all of the material off of your teeth. As far as toothpaste is concerned, I'm a Pro Health girl, Crest Pro Health. I know it can get a little bit expensive, but that's just my preference because it attacks cavities. It works with decreasing the bacterial load. It helps with fresh breath. It actually has a little whitening effect to it also, which a lot of people love that. But when it comes to selecting a toothpaste, that toothpaste actually depends upon what your oral health status is. So by the time you go see the dentist, like me, you visit, we see what's going on. If there's some sensitivity, I'll say, hey, maybe you should use Sensodyne or a toothpaste that's specific for sensitivity. If you have lots of cavities, I may say use an anti-cavity toothpaste, but I also might prescribe a toothpaste called Prevident that you can't just get over the counter. So toothpaste choices actually depend upon your particular condition, which is better determined after a dental visit.
Okay.
When it comes to flossing, flossing is just like letting the bacteria sit up in your mouth as your digestive system does. When you don't floss, the brush cannot get in between the teeth, so the bacteria just stays there, and then you end up with cavities in between the teeth that you don't necessarily see. We usually pick them up on x-rays, and a lot of times the patient will say, well, it doesn't hurt, but it doesn't mean that it's not there and that it can't cause problems later on. So even brushing at night, flossing at night, if you can't floss any other time, please floss before you go to bed.
Okay.
Is there a difference, or is the plastic or the regular floss that we use, is that better than like the water pick floss that people would sometimes use?
So when it comes to water pick flossers, water picks actually irrigate with the water between the teeth. So those are always great. It kind of you can use it in a pulsating or a stream to floss in between the teeth, but it doesn't take away or add to using regular floss. The only flosser that I don't necessarily recommend, but if that's all they use, I support flossing, is the little plackers. Everybody likes that little toothpick thing on the end, and they like that little strip that they can just stick down in the tooth. Well, the problem with that is when you use it on this tooth and you go to the next one, you're actually transferring the bacteria tooth to tooth.
Yeah.
Use the regular floss.
Use that long floss.
Yes, you can
go
pull
through
it
each
out.
piece. Don't use it. Oh.
That's right. You can unwind the floss as you use a dirty piece, put a clean piece put it between the teeth, wrap it around the teeth so that you don't cut your gums, and you keep moving until you're out of floss. And all the teeth are flossed, of course. But those are some things that are on the market that, you know, they seem convenient, but they don't necessarily get exactly what you need. But if that's all you're doing, please continue doing that and move on. Please graduate to the next thing. The other importance, you had a question?
No.
Okay. So the other important thing about brushing, cavities. Sugar really isn't the ultimate culprit for cavities. It's the bacteria that's actually in your mouth. The bacteria needs your tooth and sugar, but don't mistake the sugar as just candy. It's not just candy.
Right.
Everything that we eat in our mouth, our saliva releases these enzymes that breaks the food down. It starts our digestive process. Digestion begins in the mouth. So it breaks it down, but it breaks it down into different types of sugars. Those sugars are what the bacteria use to eat through your teeth, causing cavities.
Okay.
So if you eat a lot of sticky foods or a lot of refined carbs, that sitting on your teeth leaves you at a higher susceptibility or a higher chance of getting cavities. If you eat more crunchy foods, you notice crunchy foods don't usually sit on your teeth. You end up having a less risk of getting cavities. And if you ever come to visit us, we call them caries. Caries is another name for cavities, decay also. Also, please remember, when brushing your teeth, you always want to brush toward the gum line. A lot of times we get that toothbrush and we start going back and forth like it's a little choo-choo train, and you miss everything around the gum line. And then that's just bacteria sitting there that we call plaque. Sometimes the people say butter because your teeth look yellow, but it's plaque. And over time, if you don't brush that plaque off, it hardens and it turns into tartar, which we also call calculus, like the math. So once it becomes that, you cannot brush that off. You have to come see us or see the dental hygienist to clean that off of your teeth because a toothbrush won't get it.
Right.
Sometimes it builds up so thick on people that when it breaks off, they say, oh, I lost a part of my tooth, when in actuality, it's just hardened bacteria that you've lost. And it causes terrible breath. So
right.
So that in itself is why we really want to make sure that we're brushing and flossing, because ultimately we want to keep that bacteria down so that we don't have cavities, so that we don't get toothaches.
Okay.
That is what leads us to causing bad breath. Once again, bacteria is the culprit. The bacteria is soft. It gets hard. As long as it's staying on your teeth, not only does it form cavities, but it goes down in between your gums and cause your bone to resorb or go away. So when you look at your teeth, they're just not floating in your gum tissue. They're actually sitting in little individual sockets of bone. And if you have bacteria just surrounding that area, that bone starts to resorb, and you hear people say, oh, my teeth are getting long, or are my teeth growing? Or do I have pyorrhea? Yes, all of the above. But the technical name for it is periodontitis, or gum disease, as some people call it. But it's really the fact that you've lost bone.
I went to school with periodontitis.
And it causes very bad breath. But another culprit of bad breath is the tongue. If you stick your tongue out, the tongue is supposed to be pink, not off-white, not white, not a little gray, unless you have pigmentation on the tongue like I do. I have some spots of pigmentation on my tongue, and that's normal with people of color or darker color to have pigmentation on the tongue. But as long as you brush your tongue and use a tongue scraper to ensure that it's not white, that bacteria load is not only off of the tongue to keep it from transferring to your teeth, but it's also not going to cause bad breath.
So the white, So if a person has a white tongue, that's bacteria that's sitting there?
Yes, it's either a bacteria or a fungus. Sometimes when it's a fungus, we call it thrush or candidiasis, and we talked about that the last time. Usually when we see it as that, the person's immune system is compromised if it's thrush. But any other time you see white on the tongue, they've probably eaten something and hadn't cleaned lately, hadn't brushed their tongue at all, and we call it coated, COATED. Or sometimes people have the little hairs on the tongue that are longer and it captures a lot, so their tongue ends up being white more usual than others.
You have me looking at people's tongues now.
Hey man, look, I'll be on that tongue scraper. I got this.
So you're able to get a tongue scraper where? Like Walmart?
Walmart, Walgreens, CVS, any of your local drugstores, even the dollar stores like Dollar Tree have had the little kits where it has a tongue scraper, the little hook explorer that most people think you're supposed to pick your teeth with, but that's not what it's for. You're actually supposed to check on the chewing surfaces of your teeth to see if it feels sticky. That lets you know there's a cavity.
Okay, I got another question. Like you change your toothbrush. I'm sorry, I just got questions.
That's okay.
You change your toothbrush every month? Or every...
You're actually supposed to change your toothbrush when you see the bristles starting to fray, meaning they're starting to flatten out or lose its color. And every time you are sick, so every time you have any type of cold or illness, get rid of that toothbrush and get a new one.
Right.
And then what about the tongue scraper? How long do you just rinse it, wash it with regular soap water?
Yes, you can do that with the tongue scraper because it's plastic. I've never really ever had to replace that as much, but just out of habit, I do every 3 months. Sometimes they have one that has, you have a toothbrush with a tongue scraper on the back and you really don't know what it is. It's a toothbrush with ridges on the back. That's a tongue scraper.
Oh, so you're supposed to use that?
Yes, to brush your tongue.
Now, I have used toothbrushes with the tongue scraper on the back, but I personally like the actual tongue scraper. Like I like it better because you can actually cover more of the surface of the tongue with that.
You sure can.
Yeah, the toothbrush looks like it's a little small. Gonna take you all day to get to scrape your tongue.
Yeah.
It does, and actually with the tongue scraper, sometimes when people use them, they'll just kind of go back and forth. You shouldn't do that. You should actually go from the back forward, rinse it off to get the bacteria off. And trust me, if you're doing it properly, you'll see like little white stuff on the tongue scraper. And just to give yourself a check when you're brushing your teeth, flossing, using a toothpick or tongue scraper, smell it. Just smell it to keep yourself in check that this might be coming out. Other people might be smelling this. And it'll give you a little bit more motivation to keep things up. The third thing about causing bad breath, if you've got great hygiene, if you get all the bacteria off of your tongue, teeth, and gums, sometimes you may still have bad breath and really not know why. There's 2 other reasons. One, you could have sinus issues. You could have sinus drainage that's constantly happening and it dries out your oral mucosa, the whole oral part cavity, and causes an odor. Or it could literally be coming from your gut, from the foods that you eat.
Yeah.
Where I drive you into showing how the mouth is the gateway to your health. Your digestive system, your intestines and all of that good stuff starts in your mouth. The beginning of the digestive system is right on your face. So if you're eating a lot of unhealthy foods or foods that don't digest easily, they sit there in your stomach or they sit there in your gut and they give off gases. And those gases come right back out of your mouth.
What kind of foods are those? Like, are there a few examples?
So certain foods like beef, it takes beef about 72 hours to break down. I love beef. I love red meat. But it does take a while to digest. So even if you eat it, you want to wait some time before you eat more beef. The longer it settles there without you having a properly functioning digestive system, those odors come back out of your mouth. And A lot of times I've had patients to come in and say, Doc, can you please do something about the bad breath? And I always take steps to deal with oral hygiene first of the tongue, the teeth. And then if that doesn't resolve, even after mouthwashes, I start looking at their nutrition. I start thinking about if they have diabetes, because sometimes people with diabetes have a fruity smell or a metallic smell coming out. I have people who have chronic heart diseases where it starts smelling really bad, but sometimes they have bone loss and a dry mouth and it produces odors. So usually whatever is happening in your mouth is a telltale sign of something else happening in your body, as we discussed in our first session. So the plaque or bacteria in your mouth travels in your bloodstream. All of your other organs use the same bloodstream, and it can make whatever situation you already have or medical condition you already have, it can cause it to become worse, the bacteria that you get. So you always want to make sure that you're taking care of your mouth to keep any other conditions that you have from getting worse, and also to prevent you from even getting those illnesses. So if we talk about high blood pressure, that's the number one thing with most people, next to diabetes and cancer. Think about it this way. If I eat the wrong foods, my nutrition is off, it still starts in my mouth, eventually I'm going to have these problems. In addition to me eating incorrectly or the improper foods, if I don't take care of my mouth, any bacteria from that can make the condition even worse. So always think about your mouth as one of the integral parts of your body, because oftentimes, although the brain is here and the mouth is here, we forget about our mouths until it's time to talk.
Right.
So as far as, you know, the importance of oral health in your body, I can't stress enough how important it is to keep your mouths healthy as possible. That includes your brushing and flossing. That includes regular dental visits. Even if you're afraid, you can still come see us. We do those exams to make sure that we see what's happening on the front end. We set up plans for you to fix them and make everything better so that you don't have issues in the long run. Or even if you already have issues, we help to reverse the conditions of your mouth, and then you eventually get healthier. Questions so far?
How often do you recommend dental visits?
So you should at least have no less than 2 dental visits a year. And I mean that by examination. So you have a comprehensive exam at the first visit, and you have 6-month evaluation. And with that, you should be getting regular dental cleanings according to what the status of your bone and gums are. So if you have a healthy mouth, we'll say we want to see you twice a year for a cleaning. If it's unhealthy, we might want to see you every 3 to 4 months, just to keep you in a healthy state.
Okay, I got a question. So, what do you do for someone who's nervous, like nervous? As everybody don't know, I'm terrified when I go to the dentist. Dr. Butler is my dentist. But what do you do for people who have never been to a dentist and they're terrified? Like, they don't know like what to expect. When you say basic and you go in here to the dentist and you go in there and you hear that zzz and all this other stuff, what do y'all do for that?
So there's several options. The first thing I definitely like to do is talk to the patient, because oftentimes a dental anxiety or the fear comes from a bad experience. And I want to find the source of that fear. It could be bad experience. It could be something they've heard from someone else. So if at least I can converse with the patient to find out what's happening, I can then address or deal with each thing. It could even mean a smell in the office makes the person afraid. So we'll talk about it. I have breathing techniques that I use. We also have, there are some medications that we can prescribe. There's lollipops that we could give that can kind of help calm you down before the appointment, or prescribe an anti-anxiety medication before a procedure that you take about an hour before to help you calm down. There's other things offered, like nitrous oxide. Unfortunately, right now we're not providing that service, but we're actually working on getting that service by 2021. So that's the little gas that everybody say, oh, it's laughing gas. It's just something to calm your anxiety down so that you're calm enough to get everything done. And at worst case scenario, if the patient is way too anxious, there's options for complete sedation by a specialist where they knock you completely out, either in the office or in the hospital, do all the dental work at once, and then you walk away. Okay.
Okay. So I got another spin off that question.
Mm-hmm.
Joe always tell me I got 1,001 questions.
It's good.
So I know in neighborhood we see people of all ages. How do you do with children? We do see children as our dental services go about, but like, what do we do to help the parent? Because I know sometimes when you're being a parent, you're a little more anxious than your child.
Yes.
So you just like, how do we deal with those? Or like, is there certain different things we do for a child visit just so we can educate the community to say, hey, this is important? Or what age should you bring your child to start talking about dental health to your kids?
So we do see children of all ages. The best time to bring your child to a dental visit as soon as they get their first tooth. It could just be one in there. That's a great time to bring them because we can start educating the parent on how to care for the child's teeth and the gums. Okay. So what we usually do for children, sometimes we get kids who actually have to go immediately into some sort of treatment, but we try to introduce them to the environment, get them to see what the dental chair looks like, what it feels like, how it feels to move up and down, blow air on them so that they know if we need to blow air, it's not going to harm them. Let them kind of hear the drill and explain to them that water comes out also, but we have these little straws that get the water out. So we talk to them about all of the equipment we're going to use. We demonstrate how it works to them. And then if they are able to handle the services, we do the treatment in office. If they're unable to, due to some type of extreme anxiety, or even if they have too many things to get done, we usually recommend them to a pediatric dentist so that we don't create a bad dental experience for them.
Okay.
So how do you clean babies' mouths before it's time to brush their teeth?
So you got a couple stages. So a little baby, now they've created little finger brushes. It's a little clear finger brush and it has bristles on the little fingertip or the pad of the finger where you just use to keep their tongues clean, because oftentimes in babies, they get thrush because milk is built up. And milk creates yeast, right? A fungus. So you use that, or you can use a clean washcloth, wipe around their gums to keep the bacteria load down. Parents, as much as we love our babies, because I love mine, don't kiss your babies in the mouth.
Thank you.
Because you're giving them more bacteria. And as long as they can stay without it, your bacteria changes as you've been introduced to more foods. As long as they can stay away from that, we give them a better fighter chance of having healthy teeth. We also have stages of toothbrushes. So you've got one little rubber pad with little pegs on it that helps stimulate the gums on the babies to help them. We have little teeny tiny toothbrush heads, and you use a different amount of toothpaste as they get older according to their needs. So there's a lot of options when it comes to caring for a child's teeth, but you have to bring them to those visits so that we can actually teach you how to care for your child's teeth.
Cool.
Now, another thing just popped up for me. I know usually people will say, okay, my tooth hurt me yesterday, but it went away, so I didn't think to come back to the dentist. So the first question I have for you all, if your leg starts to hurt, unbearable pain, do you sit on that or do you go to the doctor?
Well, it just depends on my I'm going to answer like I'm in the community.
Well,
it just depends. One, I don't have that insurance.
Yeah.
Two, I don't know where to go, but to the ER, and I really don't want to sit in the ER all day and wait this long period of time. So I'm going to really wait till it get really, 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 really bad, and it start turning a different color before I go ask for what's going on. Or you have that person that says, you know, like myself, the minute something hurt, hey, what's wrong with this? Something hurt, something ain't right. I'm ready to go. So, but that is a good question because that brings back too, because I got a patient today that called and said, I got this bad toothache. Can you give me some antibiotics? And I'm like, no, you got to be seen. Like, I don't know what's wrong. We have to look and we have to go through all that. So you have to see the provider. Mm-hmm. So what do you tell people who have that? Like, well, what is your best suggestion to say, hey, do I just show up at the dentist office or do I go to my medical provider and say, hey, I got this tooth pain. Can you give me, because you're going to have to put them on some type of antibiotics so they can get the infection or whatever's out before you have the tooth pulled, because you can't pull a tooth or work on an infected tooth. Am I correct?
So let's start back with the issue of what do I do? Mm-hmm. So with pain, just like any other body part, if you see bleeding or there's a lot of pain, you do want to have it addressed then. You want to go ahead and have that appointment taken care of so that the pain can be relieved. The way you do that is see a dental provider. It's our specialty. So if you go to the emergency room because it's nighttime and you're just hurting so bad, they're going to prescribe you an antibiotic. They're going to prescribe you a pain med, but it's not going to resolve the issue. So you still have to follow up with a dental provider. The importance of seeing us is when you show up to us and say that you're in pain, sometimes it's not an infection. Sometimes it's simply a cavity. And we take x-rays, which are our pictures, so that we can see the tooth. We look at the tooth from the top of it to the bottom of the root. If there is an infection, then we prescribe antibiotics. If there isn't an infection, then we fix a tooth, because it could be either or. And the way we fix the tooth depends upon how much tooth structure is compromised. If the tooth can be saved, with the filling. But you definitely want to make sure you have it addressed with a dental health provider, because we also don't prescribe antibiotics in the same way that the medical doctors do. We have very specific antibiotics that we know will get down to the root of an infection for a tooth, because it doesn't always work like it does in the rest of the body.
Right.
And then also with us with neighborhood with services, people not going to the doctors because they don't have insurance, but at neighborhood we have sliding fee scales. You don't have to be insured. You don't even have to have income. We have fee scales to accommodate whatever your issue may be. And when you have a dental emergency, we definitely try to get you seen whether you can afford it or not. And we have payment plans to help out with that, as low as $25 a month.
Okay.
Any questions, Ian? Nope, that's a no from Ian.
Yeah. I think you might have answered most of the questions that I had so far. I'm trying to think of any more questions that you didn't already answer. Okay. Well, are there any overnight dental services? Have you ever heard of that, or things like that exist? Because we did talk about somebody may having to go to the emergency room because of a dental issue, like after 9 o'clock or something, or after 5. But are there any like late night dental services people can get?
Okay, so in Tallahassee, I don't want to answer it as a certain answer, but we don't really have 24-hour dental offices. So in a case like that, usually patients do go to the emergency room. With our patients going to the emergency room, you tend to wait for long awaited times, and you still get an antibiotic and a pain med, and you still have to come see us the next morning with the same pain.
Right.
If you can refuse putting any heat on your face, no heat whatsoever, if you have swelling, keep a cool ice pack or a bag of peas or frozen vegetables there, a tea bag or something, and cool packs only on your face to keep the infection from spreading worse, and possibly take maybe an Aleve or Tylenol and come see us the next morning. What we do offer at neighborhood is we do have on-call line that I'm usually answering the phone for that. And if you call, I can do a teledentistry visit for you. I have done several of those for patients at night. Sometimes I might have you to just use your cell phone just to let me see what it looks like via a FaceTime call or something. And then if I see the swelling, I can go ahead and prescribe you something if you have a 24-hour pharmacy or a pharmacy that doesn't close until midnight. I can usually go ahead and prescribe something for you. We usually don't like to prescribe anything blindly because we might prescribe the wrong thing.
Gotcha. Mathias, why you was looking like that?
I'm just taking it in. I'm just taking it in. It's a lot.
But even for as far as basic oral health, as far as getting everything taken care of, we have numerous open appointments for exams. We do them every day at all ages from 0 to 100 and whatever number. But we do provide those services with the full examination. We do provide limited exams, which are for emergencies. So if you have any pain, you don't necessarily have to get on a scheduled appointment. You can show up to one of our dental clinics and be seen that day. Now, I will say with limited exams, because we have scheduled patients, you have to wait some time for us to open up a space in the chair to see you. And when we do make that time to see you, you don't always get the work done that day. It just depends upon whether or not your tooth is too badly infected to fix, or whether or not we have the space to do that particular work in the schedule. But we do at least try to address your issue and get you back on the schedule to have it treated.
Okay.
Now my kid is asking for macaroni.
You're on mute.
He was muted.
Sorry, I'm back. I had a patient call me. Sorry.
I saw your mouth moving. I thought you were trying to ask a question.
No, I was trying to answer a patient call.
Oh, okay. I don't have any more questions.
No, I don't either. Just how easy is it to make an appointment? Like if I call the dentist and I'm in not even pain, but if I just call the dentist, what wait time should I look for? Like at an appointment, like how far am I looking out for appointments, or do I need to be referred to the dentist? Because a lot of people don't know that you can do a walk-in to a dentist. Do I have to be referred, or?
So for a basic dental care, you don't need a referral. Usually the dentist is the one who determines a referral, and that's to a specialist. So if you wanted to be seen for the dentist, even if it was just to get your, exam so that you can get a tooth cleaning or something, you just call to make an appointment. We have 3 locations. Our Havana location has more openings than the Orange Avenue location. Our Orange Avenue location is now booked through November, but our Havana location has openings every week. Our Rickards location is where we have dental hygienists. You don't actually get to see them until after you've had a comprehensive exam with the doctor. For an emergency visit, you just walk in from 8 a.m. to 11 a.m. and 2 p.m. to 4 p.m. 5 days a week, and we try our hardest to fit you in the schedule.
Okay.
Cool. Yeah, I feel like I need to go to the dentist now.
Yes, you too.
I know. Don't do that. Don't do that.
You gotta line up.
Yes.
Well, thank you, Dr. Butler. Thank you for once again coming to give us some great information on dentistry and keeping our oral health together and putting it in, explaining it in a way that we all could understand and be able to practically use right now. I do appreciate that about you. The way you give the information is very, very, very useful. So thank you. And for all of our viewers, once again, thank y'all for tuning in to another Healthy Happy Hour. This is our Healthy Happy Hour. So we will be back third Thursday of November, I think. Is that before Thanksgiving?
Yes.
Whatever's the Thursday before Thanksgiving, we will be back. December, we're going to let you know which Thursday we'll be there, but we do plan on having healthy happy hours throughout.
It's the 19th, Joe.
The 19th, the 3rd. So I got this calendar right here in my face and I ain't even using it. Yeah, so we'll be back November 19th. So that is before Thanksgiving. So also y'all make sure y'all check out our podcast, Mind Your Body and Soul, the Healthy Podcast, every Wednesday, nmcpodcast.com. Go to our YouTube channel, Neighborhood Medical Center. Subscribe to the YouTube channel because, you know, YouTube and social media do this funny thing, right? If you subscribe and you like and you comment and you share, more people can see it. That's so magical, isn't it? Try it and you can see the magic happen. So Neighborhood Medical Center, subscribe to our YouTube channel. Also, we're on Anchor, we're on Spotify, we're on a whole bunch of other podcast outlets that I can't even really think about right now. Google Podcasts, I think we're on iTunes, all those. So go check us out, Mind Your Body and Soul, the Healthy Podcast. And like I said, every Wednesday. And thank you once again to Dr. LaToya Butler, who is our dental director for Neighborhood Medical Center. And we will see y'all next time.
Thank you for having me. Have a good one.
Thank y'all so much.
Welcome.